So Joey, my little guy Ryan, has not been feeling good. I actually got the stomach bug yesterday, and felt so
Oof.
bad. He was sick a couple times throughout the night. Anyway, I walked out just a second ago, right before we got into this interview with Anthony, and went to grab some water. And he's out there in the little book nook, just reading. I was like, "Hey, buddy, how you feeling, man? You feeling okay?" And he's like, "I'm doing good enough for government work." I mean, kids, this is great. I mean,
He picked that up from you, didn't he?
Oh, well, I mean, I think it's perfect for this interview. So we're talking health sharing today. We've had many of you ask us questions about what we do for healthcare, how we've avoided the big blue machine here in Alabama and other major healthcare by using health sharing. And as you know, Joey and I have 1 million kids, and healthcare can be super expensive and sometimes be preventative from or prevent us from maybe being more entrepreneurial than what we want to be because of the potential cost of the threat of the cost. So I want to give you just some practical in my situation, Joe, I want you to share yours, and then we'll jump into the interview with Anthony. But for me, like healthcare, I had a W-2 job, worked for a company for many, many years. We were, trekking down the pathway, paying a couple $100s a month out of pocket for our own cost for monthly premiums. And then obviously, just like everybody else, had a, $5,000 deductible. And when those issues came up, we just paid this couple $1,000s out of pocket. And my brother-in-law, who now has 11 kids, that's right, 11 kids, they love each other a lot. And he was a medical doctor, and he was talking about how he was using this thing called health sharing. And I was fascinated by what he was doing. And clearly he's a smart guy, orthopedic surgeon, and he was having kids and using this whole healthcare, alternative. And I kind of watched from afar for a while. And finally I said, to me, this is something that aligns so much with what we do, Joey. It's the anti-Wall Street. It's the anti-bank concept. It's the anti-insurance because it's direct, right? It's going directly to the source. And I knew that I didn't want anybody else controlling the things, my money. I definitely didn't want them controlling my healthcare. And he shared with me different things about that. And we made that decision. I'm going to say it's 2014. I don't have it written down, but I believe that was the year we made that decision. And I have not looked back since. Our monthly share has been, as low as $400 something a month. I think now it's up to $550 something a month. But it has been an amazing thing for us over the last, 9 years, something like that. We have participated in it. We've had many situations where we've had to, request not a claim. I'm forgetting the reimbursement for expenses. And the blessing our family has had through that and through this ministry has been huge. Personally, I'm the one who writes the checks, who pays the bills for things. But this has been really cool in our family. I write the checks, I hand it to my wife, which shows who we're sending our share to, and her and the kids pray over that individual. Then they write a note, and then they put the check into it. So it's a way that every single month our whole family can be engaged in this process, as compared to before. That premium's just taken out of my check. I didn't even see it. It was never a discussion. We're not praying for other people. It's not even thought of. So talk a little bit about your experience.
Well, I'll say this. I was the guy in the corporate job who had what appeared to be, and I say that with very specific words, the Cadillac of insurance policies from medical care. And there was some hesitation when it came down to, I knew I was feeling called to leave that corporate job and to venture out and help Russ for the love of all that's holy with his business. But there was this question of how we're going to continue on this insurance. And so as I began that process, this was also 2014. So you must have just started shortly before me, and then shared it with me. And I started looking at the alternatives, right? So it was over $2,000 a month for a premium for me and my wife and 4 kids at the time. Like our 4th was just about to be born, maybe 6 months after I left the corporate job. And I was up again. I was like, this is absurd. But then I looked further. The deductible was like another $8,000. So I was like, wait a minute. I'm going to pay $24,000 just for the right to pay an extra $8,000. So I'm up to $32,000 before anybody pays a dime towards medical care on my family's behalf. And then compare that to the $500 a month or whatever it was for the Samaritan Share, that I'm actually in community with other believers to help them with their own needs. Like, this is a no-brainer. Number one, if I use the difference of the amount of money that I would be paying towards a premium at a traditional insurance company and the amount I have to pay on the share, if I just save that difference into my policies, my system of policies for infant and baking, if I have a major medical expense that was not covered for whatever reason through the share company, I would still be saving money. To me, it just was a crazy no-brainer. And as I mentioned to Anthony Hopp's our guest today with Samaritan Ministries, pre-show, as I said, my initial outpouring of this was, I want to save money. Like, it was a purely logical, like, dollar for dollar. This just makes sense. Since I've been a part of this, it's now philosophically become, this is what it feels like and it should be to bear one another's burdens, right? To be a part of the national, in this case, it's just national because it's not across the world, but the church at large. Like, we are all a part of the body of Christ. How can we help one another? This is one tangible way we're doing it. And oh, by the way, we save a ton of money. So it's just an amazing thing.
Well, financial freedom is when our passive income is greater than our monthly expenses. And we always want to bring you ideas to help you increase your passive income and also show you ways that can help you reduce your monthly expenses without reducing your lifestyle. This is absolutely one of those ways that you can reduce your monthly expenses if you've been on the traditional healthcare model, as well as not reduce your lifestyle. And in a lot of situations, you'll hear stories from our discussions today, how our life has actually been improved, if that's possible, in the dealing of healthcare issues as they come up. So I don't want to take any more time. This is a little long interview, but I think you're going to enjoy every step of the way as Anthony Hopp with Samaritan Ministries shares with Joey and I. Let's jump in right now.
Welcome to the Wealth Without Wall Street podcast, your guide to understanding how to get out of the Wall Street rat race and start your own mailbox money lifestyle. Now, don't let these handsome Southern draws fool you. These financial minds are teaching our country to enhance savings, increase cash flow, and create passive income, all without the help of Wall Street. Are you ready to break through? Now here are your hosts, Russ Morgan and Joey Murray.
Welcome into the show. This is a much anticipated episode. We have Anthony Hopp joining us, the Chief Purpose Officer at Samaritan Ministries. Anthony, so glad to have you as a guest today.
Thanks, Joey. Good to be with you, Joey and Russ.
Yeah, grateful to have you on. As Joey said, this is anticipated because we talk a lot about how health sharing has given us the freedom as entrepreneurs to be able to chase down our dreams without worrying about the thing that a lot of us have on the back of our mind, which is healthcare and how do we pay for that sort of stuff. So really quickly, I'd love to just hear your background, and then we'll find out a little bit more about Samaritan Ministries, which is the company you work with.
My background is actually music theory and composition. That's what I studied in college and got a degree in, and I met some guys, and we started a music ministry group. We moved to Peoria, Illinois, because that's where all music things happen. That's not true. That's just actually where they lived. And so in the meantime, when we're trying to get this music ministry thing started in the mid-90s, went to church with a guy named Ted Pittenger, who had this new thing he was doing. It was this non-insurance biblical way to meet healthcare needs, Samaritan Ministries, and I knew Ted from church and knew he was doing this new thing. And he asked if I'd be willing to help him out. It was in its beginning stages. And I told him I could help him, but I said, it's only going to be for a little bit, because as soon as this music ministry thing takes off, I'm gone. And that was like 24 and a half years ago. So I think after 5 years, he's like, whatever, Hop, you're never leaving. So yeah, I've been on Samaritan staff for almost 25 years now. I would have never scripted it this way. And I know it's pretty expected to say something like this, but man, after being part of the Samaritan mission, seeing what God has done, I wouldn't change it. It's really been awesome. So I kind of grew up with Samaritan. I did a little bit of everything because we were in startup mode. So I was doing marketing and advertising and writing for the newsletter and taking care of some of the member service stuff, taking care of inventory. And then as we grew from, I think I was employee number 5, and now we have over 400, and I'm finally settled into the role I'm in now. And yeah, it's just been such a treat to work with such a enthusiastic staff who really want to love our members and care for them and be part of such a God-focused mission.
So you've used the word mission several times. Talk about, what is Samaritan's mission?
It's to redeem healthcare. And we do that by helping the body of Christ love one another through the sharing of medical needs. And redeeming really is kind of the linchpin word of what we're doing. And to redeem something, I guess, presupposes that the thing you're redeeming is in need of redemption. And for us, it's the healthcare system. And when we talk about healthcare, we're talking about the way we pay for healthcare, not necessarily the way we receive treatment from all the wonderful providers that there are. And to say that it's broken, that the healthcare system is broken, probably is an understatement, but it's complex, it's frustrating, it's difficult to navigate. Samaritan members are redeeming healthcare in a variety of ways, I think principally through their loving one another in such a practical way through the sharing of medical burdens. But just 4 quick ways is that a lot of our healthcare is expensive, it's impersonal, it's intrusive, and for the follower of Jesus, it can be objectionable. Samaritan members do healthcare in a way that instead of it being expensive, it's often a fraction of the cost of insurance. Instead of the impersonal nature of insurance, it's highly personal. There's not this just sterile transaction that makes you want to stab yourself in the head with scissors because you're tired of dealing with an insurance company. Thirdly, we don't have to worry about the intrusive nature of healthcare. For most folks, when a third party comes and interferes, that's a pretty frustrating process too. Samaritan members redeem it by directing their own healthcare, which has a host of benefits. And then fourthly, we don't have to worry that the healthcare treatments that we share or that we pay for violate our faith and values. So yeah, redeeming healthcare is the mission, and it's really exciting to be part of that.
I love those 4. I'm glad you mentioned those, because I wouldn't have been able to think about those in terms of categories, but I'd love to break each one of those down to show the differences. So start with the expense. And how does it typically compare health sharing versus traditional health insurance?
Yeah. I think it was 2 or 3 years ago that the stat came out from Kaiser or somebody that the cost of a premium yearly for a family of 4 was now over $20,000, which at most Honda dealers gets you a pretty good Civic. So it's like, that's tough to swallow. So increasingly we have prospective members saying, my insurance premium's killing me. My mortgage now costs less than my premium. So it's not atypical to hear prospective members saying that their insurance premiums are $1,500, $2,000. And then that's not even considering the deductible. A lot of times, in order to be able to afford the premium, you got to sacrifice there. So now you're like $5,000, $10,000 out of pocket before you even see a penny. So yeah, the cost certainly is an enormous component of it.
And so give an idea of what it would cost in health sharing compared to that.
Yeah, the monthly shares at Samaritan range from $100 for a young single in our basic program, and we can break those down, to, I believe, $555 for a very large family in our classic program, which is the more comprehensive program out of the two. So that span 100 to 555 is what members pay on a monthly basis.
And you said specifically the word share.
Yeah.
Explain that. Like, why is it called a share versus a premium?
The whole lexicon and vocabulary has changed, which is, kind of frustrating for us who are used to insurance. It was for me back in the 90s when Ted was explaining what Samaritan was. I'm like, hold on, I don't understand all of these different terms. And that's not to be obtuse or just to be cute semantically. It's because this is a fundamentally different paradigm than insurance. And so when we say share, we mean it's the monthly amount that you would pay for, or in insurance parlance, it would be a premium. The reason that we make this distinction between healthcare sharing and insurance is because they really are different animals. Insurance really is a contract where one party is agreeing to be legally responsible for and assume the risk of loss for another party in exchange for a premium. Healthcare sharing is a group of like-minded people agreeing to assist one another voluntarily. It's kind of like crowdfunding, where a group of people come together and we say, all right, we're all in it. If somebody has a need in the group, we're going to come together and we're going to take care of it. So that's what we mean when we say share. Even though the language can be a little trippy at first, members catch on relatively fast.
So let's break down the second point that you had 4 different points here. First point was expense. Second point was what again?
Yeah, the impersonal nature of most healthcare.
Yeah.
I've just was talking to a friend the other day who was haggling with an insurance company, and they're at their wits' end. It's just been months and months of haggling, and it's awful, and it sucks years off of your life. It seems like when you have to go through that process, and so the impersonal nature. Samaritan members have not just the connection with each other, which we can kind of dig into, but because they're very much connected with each other month after month, because they're sharing not only in the financial need, but they're praying for one another, sending cards and notes of encouragement. But then there's also the experience of members talking to our member care center. And these men and women who serve our members are fantastic. Not only are they competent and patient to be able to help a member with his or her problem, but they really are ministering to our members in a time of need. Healthcare has a wide variety of experiences, ranging from happy things like a baby being born to maybe a chronic condition or somebody has passed away. And so to have somebody on the other line talking to a member who's able to stop and pray for them and truly see them and hear them and understand them is huge. We have members all the time who share their experience and say, Blue Cross Blue Shield never did this for us. It was such a personal approach.
Well, I'll jump in there because my wife had this exact experience. So one of our third child. So we were at that $555 group. We have 4 kids, and we've been with Samaritan, I guess, going on 8 or 9 years now. And our third child actually was experiencing many different issues that we couldn't really understand what all was going on. And we were going to different ENTs and different specialists to try to identify the problem. And after, a series of 3 or 4 different labs and specialist visits, we finally nailed it down to a form of epilepsy. And I just remember my wife calling to talk to Samaritan about, okay, now we're going to have these specialized tests done on her brain. And we didn't know exactly what the cost of that was, but we knew it was probably going to be way more than our normal allotment, and wanted to go through that for the first time. And, she's very analytical, and she's just thinking through all this stuff. And I just remember her telling me how the person said, well, first, do you mind if we just pray? Mm-hmm. And my wife just broke down in tears, because that was, obviously she has her baby in her mind and she's wanting to be a steward of the money. But at the same time, all of this is a major burden. And I just remember her telling me what a difference that was for her to have that person just stop and pray through that. And then on top of that, to say, by the way, all of these other visits that you did, we need the receipts, because all of that will go toward your redemption, or I forget the proper words for it.
Yeah.
And she was like, really? Like, we didn't even consider all of those things. She said, no, but this was all based upon this one thing. And so all of that is a shareable expense. And it was just a completely different experience than you've ever had, right? One, you call any of the major healthcare companies and you sit on hold after you go through 1,400 different autoresponders. And if you finally get the one person who could care less, right, that they're talking to you, because I mean, they get paid the same amount no matter what. It's definitely a different experience. I really appreciate you sharing that. I can totally relate with the impersonal nature.
I want to add one thing to that too, Russ.
Okay,
so
go ahead.
We had our 5th daughter through Samaritan, and you want to talk about the personal nature of the share. And I love the fact that it's called a share, because when we went through that, we paid all of the expense of her, her prenatal visits and all the whole cost to the hospital, everything. And we started to receive the reimbursement, the shares, and they are all individual checks from families all over the country, with some of them even including handwritten notes and personal cards. Congratulations on your new baby. I'm praying for Tyndall, and I'm so excited for your new child. And children are a blessing from the Lord. Scripture being shared. Like, I'm talking piles of these. I wish I had taken a picture of it, but there's just no comparison to the fact of that experience versus our previous 4 daughters being born through a traditional insurance type of situation, and just getting a ridiculous bill and then having to pay it, and nobody thanking you for anything, let alone your money.
Well, I think, and that goes into the third point, right? The third point is avoiding the third party intrusion. Talk a little bit about that. I know, Joey, you and I have plenty of personal experiences of how going direct to the doctors have benefited us, but talk a little bit about that, if you would, Anthony.
Unfortunately, a lot of our healthcare is paid for involving third parties who, even though they have very little insight into your specific situation, they often have an inordinate amount of influence on when you receive treatment, what kind of treatment you receive. These should be decisions between a patient and a provider. And so as Samaritan members, we're able to completely direct our own healthcare. So many advantages to that, ranging from you decide, your family in conjunction with your provider determine how you want to address treatment, whether that's we want to do it with more natural means. Some members decide, instead of going, if they're diagnosed with cancer, instead of going a traditional chemotherapy route, they'll do something that is a more natural alternative treatment. Okay, the guideline that Samaritan has is, as long as your provider is licensed to practice medicine in your particular state, go for it, because you and your doctor know best to make that decision. The other aspect is just that they are more engaged. As members, we're engaged. We can make better decisions. Part of the reason we're in the mess we are is we've divorced the consumer from who's actually paying for healthcare. If it's the government or my employer that's paying for healthcare, pretty soon I don't really have context for cost. I know that I've got my premium, but now it doesn't matter to me. So yeah, the intrusion part is that there's another side of the freedom. I get to choose my own provider, but members are also being wise consumers. We give a tool called Healthcare Blue Book that enables me to compare in my area to say, this treatment costs such and such here, whereas at hospital Y it costs something else. It's startling, guys, at the disparity that exists with pricing. Just as a quick example, there are so many opportunities, not just with hospitals. Like if we're if we're banged up or burned or mangled, hospitals are great for trauma care. But with all this other kind of care, chronic or non-emergency, there's so much innovation. Now we have surgery centers and telehealth, even DPCs or direct primary care. So in the Peoria area, one hospital charges $170,000 for spinal fusion. That's the room rental. That doesn't cover the doctor or the anesthesiologist. We also have a clinic in the area called Prairie Spine and Pain Institute. Same spinal fusion, $30. That'd really be a deal. $30,000 compared to $170,000, all inclusive, and they'll bring you dinner when you're released. So, with a little bit of education, members still are empowered to make their own decision, but the education component just opens up a bunch of possibilities to keep that share low.
I just read this comment. It was so drawing, Joey. I wanted to share it. I realized that my time is not really mine. It's my company's. Now I have to stop negotiating my time for money, and I need to start working to become financially free.
That's exactly how I felt when my daughter Adler asked me on the way to school, Dad, can you pick me up from school today? And I had to say, no, baby, I have to go to work. That's where I drew the line.
In order for you to be clear on the things you need to do and stop doing, and to know who you need to become so that you can stop trading time for money, join us right now at wealthwithoutwallstreet.com/passport.
Now let's get back to this episode.
Well, and one of the things I love about the ability to choose the doctor is so oftentimes I have found people who want to go see a specific doctor, a specific dentist, and what's the first question they ask? Are they in my network?
Yeah.
And unfortunately, if they're not in the network, then that dictates the decision, right? Because I've been paying in their minds, I've been paying for this premium. I'm paying to have this coverage. And now if the doctor I want to see is not in my network, then I just can't do it. I'm just going to go see someone else. They go see someone who's impersonal to them. Maybe they don't have a personal relationship. Maybe they haven't been highly referred. But because now the cost has now dictated the care, right? And to me, I think that that's so sad that we in most situations, as you just explained, we probably are getting more personalized care in that one clinic than you are in a hospital environment. Not always perfect, but generalized statement, they're probably true. And if for a fraction of the cost, but if I was doing it through a specified healthcare company, I might be in network at that one, and that's the one I end up going to. And so I've seen that so often. And you talked about other things. My brother-in-law is a physician, and he talks about the panel in which they are dictating the type of care people are getting, because it is dictated by the reimbursements that come from the healthcare companies. So they have to prescribe certain things to patients based upon certain illnesses and certain diseases or so forth. If they don't, it dictates their reimbursement rate from the healthcare provider. So now, again, we're somewhat influencing doctors' decisions between what should be between the patient and the doctor. We're bringing a third party in there that's making this whole financial thing get a little blurry.
That's absolutely right. Yeah. To your personalized approach comment, one of my friends went in for his yearly physical. Doctor does the physical. My friend takes out a list of issues he wanted to describe or talk to the doctor about. Doctor puts up his hand and says, we can't do that. You got to make a separate appointment to talk about these issues. Because it has to be billed differently. And my friend reminded his doctor, hey, remember, I don't have insurance. I do this healthcare sharing thing. The doctor's countenance changes completely. And he says, oh, that's right. We can talk about anything you want. I mean, that's insane that we're at that place, but that's where we're at. And one final word about Healthcare Blue Book, when we're comparing prices, most people might be thinking, yeah, you get a fair price, but you probably sacrifice quality. Not true. The correlation is what most people would not guess, which is usually the fairer the price, the higher the quality. So our members are looking not only at price, but how is this provider rated?
Man, that's so awesome to hear, like, those perspectives. I mean, even having your friend's experience there with the doctor, like that's a light bulb moment, right? I mean, we talk about from a financial standpoint what we put up with, in terms of like the word retirement is a lie. It's like, hey, I'm just going to put up with my work because I'm going to retire one day. Well, what do we put up with as it relates to our own health care? Because people just dictate to us how we can operate and what we have to pay and what we do get reimbursed for. And I mean, this is just a freedom that we can go towards instead of, away from the things that are dictated to us. The last thing that you mentioned is about really the freedom for the believer to not have to make decisions that go against our beliefs. Can you share a little bit about that?
Yeah, there are kind of two sides to it. One side is the obvious of, and this all has to do with doing something that's consistent with our values and our faith. And Samaritan members don't share for practices like abortion and so, or gender reassignment surgeries. So there's that obvious component where we don't have to violate our belief system by what our healthcare pays for. But then there's a positive component of the Bible has a lot to say about how we do community with one another and how we love one another. And one of the scriptures that's associated with some of our messaging to our members and prospective members, things like Galatians 6:2 of bearing one another's burdens, and Philippians 2, and Paul talks about we look to others' interests. We also like to highlight that in the New Testament, there's about nearly 50 commands around one anothering, that we love one another, we share with one another, we pray for one another. So this kind of approach allows Christians to really live out their faith in a practical way, that in this area of healthcare, who would have thought that historically has been kind of just transactional, allows us through being in meaningful community with one another to really practice the one another's of Scripture. And, when you mentioned it before, that when you receive those cards and notes, nothing really prepares you for it. I can't tell you how many, even on a weekly basis, member testimonies we get of people who went through that process of having a large medical need. And you'd think the first thing out of their mouth would be, holy cow, these strangers sent me $100,000 to take care of my medical need. It's not. It's the cards and notes where they say, it blew us away. We didn't feel alone. They were reminding us that God was going to take care of us. And we felt such a connection with these other members who we probably won't meet this side of eternity, but doesn't matter because we were all unified around Jesus. And that, that all springs out of this like-mindedness of we're able to do something that's consistent with our faith.
I love that. Hold on, Russ. Hold on.
What?
Somebody that just is listening to this is they said, is this a faith-based thing? Like, I have to be a Christian to take part of this. I mean, all this sounded good up until you started talking about being a Christian. Can we just say, let this be the reason that you follow Christ? Like, let it be the first thing that you're like, wait a minute, these guys introduced this to me. And by the way, there's the most incredible benefit is that you are no longer held to your sin. You're free from sin because Christ paid for you. And by the way, there's all this community across the nation that will help you with your medical benefits. I mean, this is the best news you could hear today.
Anthony, you don't know Joey's humor. He was not being dead serious on that. Most of the people know that he's being sarcastic.
Hey, we got to build the kingdom, bro. Come on. What are you talking about?
Get saved, man. Affordable health care, and meet the King of Kings as an added bonus.
Well, right. I mean, I'll take it. I mean, again, there's all sort of perks, right, in the kingdom, but that definitely there's other things that we need to save other than money first. So that we'll leave it there. But I agree with you. Everything that you said there, going through the expense, going through the impersonal nature of traditional healthcare, having third-party people paying for things that we don't believe in, all of that just goes into many, many reasons why Joey and I love Samaritan, and our families have been so blessed through that process. All right, I'm going to jump on the con side. I want to sit in the seat of the scoffer here, if you will, and throw some stones at this and let you kind answer some of these questions. So one is, well, how do I know there's enough money in this thing? I see you three guys are doing it, but who else? How many people are within this Samaritan group? How do I know that if I have a major need that's going to be covered?
That's the fundamental difference between this and insurance, is that members don't have a guarantee. That's what's so stinking scary about this, is that we come from a mentality, and I think that it's a false hope, because you guys probably have heard horror stories too, where people thought, man, my insurance was supposed to cover this or whatever, but there's a lapse in coverage, or there's some change in policy, or whatever it is. But it's not as ironclad as people think. But with healthcare sharing, we're being upfront to say there isn't some kind of reserve that's sitting here. We're not guaranteeing that your medical needs are going to be shared. Now, the reality is, they have for now almost 28 years, they have been shared. And with 85,000 households, 280,000 members, we were working with about $30 million a month, every single month, that's being shared among our members. So there's a pretty impressive track history, but it does come down to faith. But I think at a more granular level, somebody is wondering, all right, let's say I have a medical need. Two things I'm worried about of it not getting shared. One is, what if somebody doesn't send to me? Two, what if it's just an exorbitant amount? The first one is, I think, satisfied in the fact that the sharing process is highly coordinated and organized. Healthcare sharing Samaritan style isn't, let's pass a hat, cross our fingers, hope you get enough. You need 50,000? All right, well, we'll see. Maybe you'll get 18, maybe you'll get 20. If you have $50,000 in medical expenses, then we assign or allocate enough members to send their shares to you. Anybody who doesn't send, then we send a car with tinted windows, and Guido gets out. And we don't do that, but we do send to those who are negligent in sending. We send them a reminder, because it's usually just an oversight. But in the event that the member still doesn't send, that person is ineligible to be part of the sharing program. But the amount that you didn't receive gets reassigned to another family the following month. So you're not left hanging. The second issue of, well, what if I have a medical bill of $1 million, $2 million, which we've had? We have an optional sharing program called Save to Share. About half of our members, 60%, participate in it. Just for those things that go over $250,000, it's there. And it's been for the entirety of Samaritan's existence. We've never seen a need not be shared. Even those ones that are well into the millions have been shared. As a caveat, if there is any bright spot in such a large need, it's usually the larger the need, the bigger the discount. So that helps significantly too. But there still is a faith component, so that's why for the skeptics who are saying, yeah, but well, we know this isn't for everybody. If you're wanting the guarantee of insurance, because insurance guarantees some things that aren't pleasant as well, then healthcare sharing probably isn't for you. But the track record is that for the 28 years members have been doing this, medical needs get shared.
Well, I can tell you from a timing standpoint, I love the fact of being able to walk in, and whenever they want to hand me 14 pages, and we know 6 of those have to deal with health insurance pages, I just say, by the way, I'm cash patient, so you can keep all of those. I'm not going to fill out all that. And I don't even care to share my social security number and all that stuff with them anymore. All that stuff's related to the health insurance world. Like I paid cash, and coming from a family with my wife's a dentist, my brother-in-law is an orthopedic surgeon, my other brother-in-law is a vet. They all love cash. They all love the cash paying patient. They get so much more money. They get it quicker. And from our end, it's cheaper because ultimately speaking, as you said, because we are working within a faith-based standpoint, one of the things I love about this, there's things that we don't pay for, all those things you mentioned earlier. And part of it too, I believe, because we have a group of people who are living, still unfortunately in a sin cursed world, right? But living to glorify our Savior, is that our cost for normal things that I think the average person is dealing with and having to pay for others who aren't living in the same way is a much higher rising cost. Talk a little bit about the cost. You mentioned the $500 to the $555 per person, depending on the scenario, right? The family size. How frequently has that increased over the last several years, 10 years, 20 years, whatever? Talk a little bit about that.
Yeah, there have been, I believe, 12 increases since we started in 94. They're usually every 2.5 years or so. A unique feature is that the members decide. In fact, members are voting right now whether or not to raise the share. Our last share increase was September of 2019. So, right at about 2.5 years. So, yeah, the increases that have happened historically are less frequent than what we see with insurance, and they're more modest. Our last increase was 7%. And then it's really a unique feature, I think, that throws people for a loop when we say all 85,000 households vote whether or not to raise the share. The flip side of the share increase not passing is that we prorate the members who have a medical need. They'll receive less than 100%. So last month, I believe we prorated at 10%, which means that all of the members who had a medical need in that month, 10% wasn't shared with a maximum prorated amount. I know we're getting into the weeds, but this is an important factor, lest somebody think, oh my goodness, 10% of $1 million is 100,000. The max amount that we would prorate a member is $2,500, which when you compare that to a lot of deductibles, it's like, okay, well, $2,500 is going to hurt. It's not going to be catastrophic. The other aspect that's worth mentioning is that in those prorated months, because Samaritan members are so generous, we have a member assistance fund where people give above and beyond. So a lot of times those prorated amounts get taken care of anyway. So that was a little bit in the weeds there, Russ, but that's how our costs are increased.
Well, so one point to note too is how many times over the last 25 years have you discounted premiums?
Good question. It's not been as many that we've actually had to prorate, but in the last 5 years, probably 7 or so times that we've had a share decrease. The most recent being January of 2021 was a 19% decrease. That's not common. I think some of that was COVID influenced because I think a lot of people were delaying non-emergency care. It's just kind of a wacky time altogether. But yeah, share decreases. How many times does your insurance company send you a notice that say, guess what? This month you send 10% less. Yeah.
Never. That never happened. So let's talk a little bit about, and I know we're probably getting short on time, but there's a lot of really good questions that still remain. COVID, how did it affect health sharing? Like what's the feedback on that?
Well, from a staffing standpoint, it left us scrambling. In the early days, I guess it was now 2 years ago, we didn't know in our own state, we were having lockdowns. And so we very quickly had to pivot from an almost entirely in-person staff, about 400 staff, to I think 90% remote in a matter of 10 days. And a credit to our leader, our IT leadership and his team. They got it done. So that was impact number one. Secondly, was being able to just care for our members in a time of uncertainty. And by God's grace, it was generally uninterrupted that we were able to still serve them and be available. I think the third impact was we started to see anomalies with the trend of how medical needs were presented. For us, it dropped off a little bit, and that seemed to be consistent with what the rest of the industry was experiencing because people were delaying non-emergency items. As I mentioned, that's probably the reason for our share decrease in January of last year. So I'd say those three really would be the big ones. As far as did COVID illness itself impact the shares? Not really. That's as far as Samaritan members sharing medical needs resulting from a COVID illness, absolutely. Just according to our guidelines, the way that we share any illness or injury. So we certainly saw some, but we didn't see a marked increase in actual COVID expenses.
That's awesome. Thank you for updating us on that. So one other question More on the con side, Russ was starting down that path and we didn't get very far. But one of the things is the reason you're able to keep the costs low for shares, one of the reasons, we've already mentioned several of them, has to do with pre-existing conditions and the limitations there. Can you speak a little bit about how, like, what the policy is there and how that helps, to maintain these lower costs?
Yeah. A pre-existing condition never disqualifies a person from joining. So that's a pretty important point. There are, however, guidelines and restrictions on what can be shared. Once a member is healed or doesn't have any treatments or symptoms for a year, not being a member for a year, but just have gone a period of 12 months where it's not an issue, then most issues are no longer pre-existing. And our guidelines give all the details on that. But I mentioned the Member Assistance Fund is just fantastic for getting some help to those things that are pre-existing. But we recognize healthcare sharing isn't for everyone. And one of those groups that it might not be for would be somebody who has a chronic illness where they are incurring regular monthly expenses. This might not be the best financial situation for them. However, there would be some pre-existing conditions that, because I'm saving $1,000 on my monthly premium compared to what my outlay is to pay for my pre-existing condition, that can be an interesting comparison. But I want to speak to the philosophical argument where some naysayers would say, well, those healthcare sharing ministries should be covering them. A couple things. One is that insurance companies deal with the problem of pre-existing conditions on the back end, meaning that as people get sick, they can either raise somebody's premium or they can just drop out. A product can disappear. We've seen that in the recent years where all of a sudden a product's gone. We don't disappear on our members. They can stay members as long as they want. Secondly, insurance companies weren't required to cover pre-existing conditions until they receive subsidies from the government. And of course, healthcare sharing doesn't receive any such subsidies. And then finally, if you think about the economics of it, how expensive life insurance would be if a policy could be purchased after you died, or with car insurance after you were in an accident. So our U.S. healthcare system actually incentivizes going uninsured until you're actually sick. So, I mean, that's a whole economic discussion. But the point is, you can still be a Samaritan member. There are still ways to get pre-existing needs, get them shared through some voluntary giving.
Man, I've seen that. Be honest, just transparency. Every time that we've ever had one of those decreases, what we did is just took that extra and either applied it, to one of the unshareable expenses that were, put on our newsletter, or donated it from that other standpoint. I love that aspect of it. I love the ability to bless people who are dealing with things. I know Joey's had some chronic health issues. He could talk about that probably at a different time, and how Samaritan has still been able to cover lots of stuff and reduce his cost of what he was paying for medication for all of those things. If you're interested in this concept at all, again, as Anthony has so clearly laid out, it's not for everybody, but it shouldn't be the burden that's preventing you from taking a step into entrepreneurship, because there are so many people. As he said, there's almost 80,000 members, or a little over 80,000 members within Samaritan itself. This is not a small thing. This is a large group that is covering people all over the U.S., and even some missionaries, I believe, across the world are part of this. So it's definitely something that has been going on, as he said, almost 25 years. Anthony, for those who want to find out more, where would you send them to go gain information on this subject?
SamaritanMinistries.org is great. Lots of information, some good member videos, which I think are helpful when this is such a new paradigm. It can be, there can be some encouragement and assurance that comes from hearing other member stories of them being on the front end. They kind of recount how they heard about it, the nervousness they were feeling, the reticence to jump into something new. And a lot of times in those interviews on our website, they'll talk about then the process. What was it like to go to the doctor and say, I don't have insurance. I do this wacky healthcare sharing thing. What was it like to wait for the money and to receive the cards and notes? So those videos are really good to gain some confidence that this has been working for folks for almost 3 decades. And then all of our guidelines, all of the specifics and details are laid out clearly as well. And then for people who go through that discovery process, you're welcome to give us a call. We have a great staff that helps members understand how it would work for their situation in a very non-pressure way, just to do more discovery. And then people can also join online if they get to that point and say, this is right for our family.
That's so awesome, Anthony. It's been a pleasure to have you on the show today. We have been everybody is asking us about this when they're trying to make that step out of, let's say, a W-2 type of position into more of a side hustle, and then, having their own passive business at some point. So this is hopefully one hurdle that they can take out of the way. And really, really appreciate your time. For those of you who are joining us, we're grateful to have you. Hopefully this was exactly what you needed to hear. And if you enjoyed it, please like it, share it, review us on iTunes. That's how more people get to hear this good information and get freedom on the other side. Thanks again. We'll catch you on the next episode.
This has been the Wealth Without Wall Street podcast. Don't forget to subscribe to the show to break free of the Wall Street mindset and begin building wealth on your own terms in places you understand, so that your wealth will never run dry. See you next episode.